Hello everyone, this is Dr. Maruti here. So we'll be discussing about the recall questions of FMG which happened recently on the July 30th, right? So my dear students, in this all these questions, which has been recall questions, so these are purely based on how well the students recall the questions. Okay, so we will try to give you even better insight if we get a complete reconstruction of the question. But as such, among the questions, so whichever we have got so far, let me discuss those. Right now, which of the following adverse effect is not seen even after a year of lithium therapy? So after 1 year of lithium therapy, after 1 year of what? Lithium therapy also, which of the following is not seen? The first and most important thing I want you people to notice, so we are talking about lithium. Lithium is a drug which is used for the treatment of mania, and also bipolar disorder. Mania and a bipolar disorder. Okay, so for mania and bipolar disorder, we use lithium. So lithium causes some side effects. What are those side effects? My dear students, lithium affects the thyroid gland, which can cause hypothyroidism, of course. It will damage the nephron, causing nephrogenic diabetes insipidus, which I have clearly told you people in the notes. You can find it. Now, in the nephrogenic diabetes insipidus, if at all they ask you next time, the question will be, what is the drug of choice? If they ask you, the answer will be amyloid. Okay, so amyloid will be the drug of choice. Now, tremors can also occur. Yes, with lithium, tremors can also occur. The side effect which is not seen here, my dear students, remember, that is your tardive dyskinesia. Okay, now tardive dyskinesia is a side effect associated, usually it is an extrapyramidal symptom. It is side effect of antipsychotic drugs. Okay, so this is the most important point to be remembered, right? Let's go to the next question. So a patient of Pheochromocytoma underwent a surgery. Okay, he underwent a surgery. Which of the following agent is given prior to the surgery, means before going to the surgery, to control the intraoperative hypertension? Means pheochromocytoma, all of you know, it is a tumor. It is a tumor which produces adrenaline, noradrenaline, mainly adrenaline. Okay, so it is a tumor of adrenaline producing tumor. So for that treatment which we are going to use, my dear students, the best answer is alpha adrenergic blocker. That will be your irreversible drugs. So which are those irreversible drugs? That is a irreversible drug which is a non-selective alpha blocker. The drug would be your phenoxybenzamide. Again, this was a highlight which I had given to you people in the notes. So the best treatment for pheochromocytoma, which we discussed in the class, what was that? The best treatment will be surgical treatment, but to control the hypertension before going to the surgery, that will be a phenoxybenzamide. That is a alpha adrenergic blocker, my dear students. What is that? Alpha adrenergic blocker. Okay, let's get to the next question. So here I have mixed some of the biochemistry question as well. A patient of chronic alcoholism. The first point here, remember, he is a chronic alcoholic. Okay. Now chronic alcoholism present with the symptom of confusion. Okay. And ophthalmoplegia, ataxia. If you remember, we used to discuss one thing called as a mnemonic, that is only called as GOA. That is only global confusion. Global confusion. Apart from global confusion, ophthalmoplegia, and there is one more thing, that is ataxia, that is imbalance. Okay. Now this GOA is a clinical feature of what is that? Wernicke's encephalopathy. Very good. Wernicke's encephalopathy will be caused by the deficiency of vitamin B1. The other name for vitamin B1 is your thiamine. Okay, so thiamine deficiency will lead to global confusion, Wernicke's encephalopathy. Okay, vitamin D deficiency usually leads to osteomalacia in adults, and in children it will lead to rickets. Okay, B12 deficiency will cause neurological symptom. Agree with you people, but that is due to demyelination that will be associated with anemia. Vitamin C deficiency will cause a symptom such as bleeding in the gum and all, right? Okay, let's go to the next question. A 44-year-old patient with a history of HIV positive presents with the OPD with the complaints of blurred vision and fluorators in the left eye. Okay. The fundoscopy reveals cotton wool spots and pizza pie appearance, and the diagnosis was made. The most important, remember, cytomegalovirus retinitis is made. CMV retinitis is made. So, what is the best drug for the CMV? So, let's look at the option here. So, the option is acyclovir. Acyclovir is the best drug for all the herpes infection. All the herpes infection. Cotrimoxazole. Cotrimoxazole is a type of, what is that, combination of your combination of your two drugs. It is a combination of your trimethoprim and sulfamethoxazole, right? So this is a drug of choice for pneumocystic javaroki. Okay, so this is the most commonly associated complaint or a disease. It is a type of complication of HIV patient only. In the AIDS patient you are going to get, but this appears, these patients will come with a atypical pneumonia. It will come with a atypical pneumonia, my dear students. It's a atypical pneumonia. The drug of choice is cotrimoxazole, and the best drug for our patient will be ganciclovir. That is ganciclovir. Ganciclovir is a drug of choice for your CMV retinitis. CMV retinitis. Okay. Let's go to the next question. A 70, this question, oh my god, so many times I told you people and made you highlight in every time we discussed about it, right? So a 70-year-old patient was brought to the OPD with the complaints of urinary hesitancy and incomplete urination. Okay. EVG shows enlarged prostate gland and residual urine volume of 130 ml. So residual urine volume, first thing, residual urine volume, normally it will be, my dear students, 100 ml. Okay, normally residual volume will be less than 100 ml. Our residual volume should be less than 100 ml for a patient, but it has gone up to 130 ml and prostate is enlarged. So this is likely a case of benign prostatic hyperplasia. For this patient with a benign prostatic hyperplasia, I have told you people, for a patient with BPH, symptomatic relief, I have been always telling you people, symptomatic relief, please pay attention. Symptomatic relief can be done with the help of alpha 1A blockers such as tamsulosin, understand? So tamsulosin is a drug which is used for the symptomatic relief, but pathogenetically BPH occurs based on 1,5 dihydroxytestosterone. So the best drugs are your 5-alpha reductase inhibitor. Okay, why 5-alpha reductase inhibitor? Remember, used to have testosterone. This testosterone, with the help of an enzyme called as 5-alpha reductase, it will get converted into 1,5 dihydroxytestosterone. This fellow will cause, what is that? Enlarge the prostate. Okay, so prostate growth usually due to, what is that? 1,5 dihydroxytestosterone in a patient with BPH, benign prostatic hyperplasia. So to treat this patient, the best drug would be, what we can prefer would be this one. What is that? 5-alpha reductase inhibitor. The drugs such as finasteride. What is the name of the drug? That is your finasteride, which usually inhibit 5-alpha reductase enzyme. So this is the answer for this case. Understood? Let's go to the next one. A new drug, bedaquiline. So newer anti-TB drug is your bedaquiline. It is approved for the treatment of multiple drug resistance TB. Of course, the mechanism of action of this drug. Okay, so remember, it inhibits ATP synthesis. It inhibits ATP synthase of the mycobacteria. Basically, it will decrease the ATP production. It will inhibit ATP synthase enzyme, because of which bacteria cannot survive. So that is the mechanism of a newer anti-TB drug, that is a bedaquiline. That is your bedaquiline. Okay. Now there are other anti-TB drugs. Most of the anti-TB drugs from the first time, usually they inhibited mycolic acid synthesis, but here remember, it is due to ATP synthase inhibitor, that is your bedaquiline. Okay. Let's get to the next question. Oh, this question is a very interesting thing. Okay. Now, a patient, thalassemia patient with a history of multiple blood transfusion was brought with chronic iron overload. Please pay your attention. chronic iron overload. Chronic iron overload. Which of the following will be preferred oral agent for the managing his chronic iron overload symptom? Remember, usually we will have some drugs such as desferoxamine. We had a desferoxamine. This desferoxamine is only called as deferoxamine in the other name is deferoxamine. It is used, my dear students, for the acute iron overdose. So acute iron chelation, we use desferoxamine. If desferoxamine is not there and here is the chronic, the best answer is will be your deferriprone. What is that? Deferriprone. Deferriprone is used for the chronic iron overload. So after multiple transfusion patient comes, means then you are going to go for a deferriprone. So this basically major part of this question is from the medicine pediatrics, but here we will be dealing with pharmacological aspect. So important thing, please note. So it is a deferriprone. So desferoxamine is the drug of choice for acute iron overload. Okay, which of the following agent is preferred in the treatment of benzodiazepine overdose? Oh my god, this is a very easiest question. We have written it all, like, in the most important points. Okay, so literally I'm seeing more than till now whatever the questions I have seen, almost everything was highlighted in our notes. Okay, which of the following agent is preferred in the treatment of benzodiazepine overdose? Now please remember what are the option given to us. Famiprazole, my dear students, famiprazole, or one more substance, that is ethanol or ethyl alcohol. Ethanol or ethyl alcohol is used for the treatment of alcohol overdose or even methanol overdose. For the methanol overdose, so antidote will be formiprazole. Okay, naloxone is for the opioids. Okay, the best drug, folic acid or folic acid, no, that is not the answer. The best answer is your flumazenil. Benzodiazepine overdose, always it will be flumazenil. Always it will be, the answer will be flumazenil. That is the antidote. Okay, so this is a very important point which we again highlighted from our notes itself. Okay, now this is a very confusing question, I understand. Now I'll solve this doubt for you people. Okay, very easy. Now listen to me. A group of friends went to trip to Ladakh. Okay, it is a very high altitude place. As soon as you go to high altitude place, you are going to get mountain sickness. You are going to get mountain sickness. At high altitude, as soon as we go, what you are going to get is a high altitude mountain sickness. He is having headache, nausea, dizziness, and exhaustion symptoms. See, most important, most of the people think that, sir, it might be motion sickness also. Motion sickness presents with nausea, severe nausea and vomiting. Okay, first thing. Second thing is that here we are talking about a high altitude place. We are not talking about going into the turn and twist. We are going into the higher and higher area. Okay, so this is a difference you need to pay attention. Okay, now what are the options given to us? Sumatriptan. Sumatriptan is a drug used for what is that? Acute migraine attack. The sumatriptan is used. Okay, so then we have acetazolamide, my dear students. It is a carbonic anhydrase inhibitor. We taught you in the diuretic chapter. The same thing is highlighted for you people. Now listen to me. Carbonic anhydrase inhibitor will cause metabolic acidosis. Okay, so this property can be used for the treatment of acute mountain sickness. The best answer is acetazolamide. Okay, now such scopolamine, where do we use? Understand, it is used for the prophylaxis of motion sickness. Okay, so this is the story of your scopolamine. Sir, one more thing is that we used to usually get confused. Morning sickness. Morning sickness, we have a combination drug which is approved in India. What is that? That is only called as doxylamine plus vitamin B6 pyridoxine. That is the best combination for the morning sickness. So three sicknesses: mountain sickness, carbonic anhydrase inhibitor, which I had told you people to read it over and over again and again. And for morning sickness in pregnancy, we use doxylamine plus vitamin B6. And for the prophylaxis of the motion sickness, we use scopolamine, my dear students. Promethazine is an antihistaminic drug which can be considered in the later stage of what is that? That is your motion sickness, but it is an antihistamine with an anticholinergic property. It is an antihistamine with an anticholinergic property. Okay. Okay. Now, again, this question is very easy. We had put a table, if you remember, alcohol metabolism. Okay. So a person brought two bottles of liquor from the shop and later presented with drowsiness, ataxia, blurry vision. What will be the antidote? So please understand. So these symptoms look like a methanol overdose. It looks like a methanol. Maybe there is a adulterated alcohol. Methanol will undergo the effect of one enzyme called as alcohol dehydrogenase. Alcohol dehydrogenase. Hydrogenase. Okay. Now it will become into formaldehyde. Then it will become into formaldehyde. Now this formaldehyde is a very dangerous combination. Formaldehyde. So please listen to me. The famiprazole or ethyl alcohol, both of them act here only. So famiprazole inhibit this enzyme. Ethyl alcohol will compete for the same enzyme. So that is why we are going to use which drug? Famiprazole or ethyl alcohol. Okay. So it looks like a methanol overdose. Naloxone is used for opioid overdose. And again, in the same question, if you find two times the same option, you'll get confused. So the best answer is flumazenil. Okay. Which of the following drug of choice for facial nerve palsy? Facial nerve palsy, which is also called as Bell's palsy. Okay, so for the Bell's palsy, now many students have a confusion. Sir, acyclovir is also used. See, acyclovir is considered along with the regiment, but the best drug in ENT you would have learned. The best answer is your prednisolone, my dear student. Best answer is your prednisolone. Okay, the best answer is prednisolone. Okay. All right. Among which of the following SSRI is used for the management of depression? So easy question. They're asking directly, they're asking selective serotonin reuptake inhibitor. You don't have to look at depression, first line, second line, nothing you need to look at. You need to look at this one and understand which is SSRI. So let's go from down to up. Lithium. Lithium is a drug of choice. It is a mood stabilizer which is used for mood stabilizer, which is used for your bipolar disorder. Okay. Bupropion, it is a type of atypical antidepressant. Imipramine, my dear students, it is a tricyclic antidepressant. Fluoxetine is a SSRI, and in today's time, the first line of depression usually we starts with the SSRIs. That is your fluoxetine. That is your SS selective serotonin reuptake inhibitor. I have been telling you people the uses of fluoxetine. We made a note. If you people remember, selective serotonin reuptake inhibitor. They are also drug of choice in the psychogenic premature ejaculation. Both of them we highlighted. Remember? Okay. HIV positive woman who was not receiving a treatment gave birth to a boy. What was the newborn's initial course of treatment? Okay. Now please listen to me. Gave birth to a boy. So please understand, if it is if this question has a controversy because some students are telling me that, sir, after 6 weeks, after 6 weeks, or some people are telling 6 months. Okay, so the best answer among this one is your NVP, that is nevirapine. For 6 weeks nevirapine is used. Okay, the best answer is nevirapine. Then cheese reaction, wine consumption, which drug is responsible? Remember, cheese reaction is due to a compound called as tyramine. Now, tyramine usually inhibits monoamino oxidase. The same way, this drug, same way, which drugs are responsible? The answer is MAO inhibitor among the given options. And what you people have said, among those, the best option for the combination of these words would be MAO inhibitor, but this is a lack of information. But still, cheese reaction, wine consumption, which drug is responsible? That is your MAO inhibitors. which of the drug undergo Hoffman degradation? Hoffman degradation is what? I told you people, normally what happens, any drug which is given to the body, the enzymes in the liver will metabolize them. But here it is not like that. The drug itself will undergo molecular change. The drug itself, as soon as you give, drug itself will undergo molecular change and it undergoes degradation. It is not dependent on kidney or not dependent on the liver enzymes. There are two drugs we always told you people, we have highlighted cis atracurium and atracurium and atracurium. Atracurium and cis atracurium are the two drugs which undergo Hoffman degradation. Okay, so among the questions which I have got from the biochemistry and pharmacology and other subjects integrated as well. So among these are the important questions to be discussed. So if you have more questions, please drop it to us in the comment section or just send it to us. We will give you answers as best as possible. All right. Thank you.